Hi guys, Dr. A. Continuing our hepatitis serology basics, we are going to look at hepatitis B. So hepatitis B, or HBV, is a DNA virus with an incubation period of 1 to 6 months, with the average being 2 to 2.5 months. It is spread by bodily fluid contact, most commonly as a sexually transmitted disease, but also via contaminated needles, as within drug abuse or needle stick accidents, shared razor blades or toothbrushes, non-sterile tattooing or body piercing, blood products, or what we call vertical transmission, which is transmission from mother to child, generally at birth. There is an increased prevalence of hepatitis B in Southeast Asia, China, and Sub-Saharan Africa, with 10 to 20% of the population being hepatitis B carriers. The incidence of hepatitis B carriers in the U.S. is approximately 0.5%. So here is a diagram of what hepatitis B looks like, and this is going to be relevant when we talk about hepatitis B testing. So the inside of viral particle, you have the DNA, the hepatitis B DNA, and it is wrapped in capsomeres, which is going to be hepatitis B core antigen, and then that is wrapped in an envelope, and that envelope is going to be the hepatitis B surface antigen. And then there are also some other little proteins associated with that are going to be the hepatitis B E antigen, or E for envelope. So we have a surface antigen, an envelope antigen, we have a core antigen, and we'll have antibodies to those also. So let's talk about hepatitis B testing. It can be detected by viral markers before the symptoms occur or before ALT and AST begin to rise. There are 3 hepatitis B antigen and antibody tests that are relevant to the diagnosis and management of this disease. So the hepatitis B surface antigen, it is present on the surface of the virus. If it is present, it reveals an active infection, and it is detected for a greater window of time during infection. So it means the virus is present and active in the body. So that's usually one of the first tests that is done. It can pick it up the earliest. And then the antibody to that surface antigen, so it's the hepatitis B surface antibody. It is a neutralizing antibody against the hepatitis B surface antigen. They are central to natural and vaccine-induced immunity. So if you've been vaccinated against hepatitis B, you should have anti-HBs antibodies. It is associated with a resolved type B hepatitis or patients who have responded to vaccination for hepatitis B virus. There is also the core. So hepatitis B core antigen, and then the hepatitis B core antibody. So a little more about the antibody. It is a non-protective antibody, so it wouldn't show immunity. It can be an IgM type of antibody or a total antibody test. The total antibody test does all isotypes of anti-hepatitis B core. There would be IgM and IgG. Usually those are the 2 predominant ones. It is a marker of infection. It is seen in acute type of hepatitis B. It is seen after recovery from type B hepatitis, and it is often seen with anti-hepatitis B surface antibody, and it is also seen in chronic infections. So there you go. So that's a core antibody. And then we have the E antibody, E for envelope. So first, in antigen. So first is the hepatitis B E antigen. It's indicative of large amounts of circulating hepatitis B virus, so really fulminant infection. Patients that are positive for hepatitis B E antigen are 5 to 10 times more likely to transmit the virus than those that are hepatitis B E antigen negative. The anti-hepatitis B E antibody is a non-protective antibody also. It is also a marker of infection, just like the anti-hepatitis B core antibody. and it might be indicative of a chronic hepatitis B infection. So if we look at all of them together, this is how we interpret. So if the hepatitis B surface antigen is positive, but the anti-hepatitis B surface antigen is negative and the anti-hepatitis B core antibody is positive, then there is an acute infection or chronic hepatitis B. If the hepatitis B surface antigen is negative, but the anti-hepatitis B surface antibody is positive and the anti-hepatitis B core antibody is positive, that is a Hep B infection that's been resolving or a previous Hep B infection because like the virus is cleared because the surface antigen is negative. And if the hepatitis B surface antigen is negative, the anti-hepatitis B surface antigen is positive, but the anti-hepatitis B core antibody is negative, that is a resolving or a recovered hepatitis B patient or a patient after vaccination. So the vaccination is expected to increase this anti-hepatitis B surface antibody and none of the others, obviously. So acute hepatitis B, the hepatitis B surface antigen titers usually will develop within 4 to 12 weeks of infection. Increases can be seen even before the elevation of the aminotransferases to ALT and AST or the appearance of clinical symptoms like right upper quadrant pain. As anti-hepatitis B surface antibody titer develops, the hepatitis B surface antigen levels will decrease because the antibodies are neutralizing the antigens. So that indicates resolution of the acute phase of the infection and the development of immunity against hepatitis B. There may be a window of time where neither the hepatitis B surface antigen or the anti-hepatitis B surface antibody is detectable. During this time, the hepatitis B core antigen could be used to diagnose an infection. Anti-hepatitis B core antigen IgM antibodies can be used to differentiate an acute infection from a flare of chronic HBV. So again, IgM is always going to indicate an acute infection because it's the first antibody to rise the first time you encounter that virus, that infectious agent. So chronic hepatitis B is often mild, but it can progress to cirrhosis. Cirrhosis is a scarring of the liver where wherever there is scarring, then liver function is not there. And so the more scarring there is, the less liver function a person has. It can also progress to liver failure, and it can progress to hepatocellular carcinoma, which can contribute to premature death in 15 to 25% of cases. The development of chronic Hep B is suggested by elevated liver function tests for 6 months and the persistence of the hepatitis B surface antigen for more than 6 months. Some chronically infected patients produce anti-hepatitis B antibody and subsequently clear the hepatitis B antigen well after the acute phase is over, so it's called late seroconversion. The clearance of the hepatitis B antigen is associated with a decrease in viral DNA and some degree of remission in the chronic hepatitis B cases. Chronically infected patients usually lack anti-hepatitis B surface antibody, but in some cases, low levels of the non-neutralizing antibodies, so the Anti-HBc for core and the Anti-HBe for envelope, could be present. Lastly, we have the hepatitis B viral DNA test. So hepatitis B virus DNA is detectable an average of 25 days before seroconversion. So that would be, seroconversion is when the antibodies show up. It can be used to screen blood donors. These are molecular assays that can reveal active viral replication in either acute or chronic infections. You can quantitate serum viral load to use in treatment decisions and to monitor therapy. There are 8 genotypes of hepatitis B virus that have been identified. So if you can identify the genotype, then that could be valuable in determining appropriate therapy for chronic infections. So for example, the genotype A responds better to interferon. So patients with this genotype of infection, of Hep B infection, could benefit from starting a treatment with interferon as opposed to other oral agents that are available. So there you go. And that is going to wrap up our hepatitis B testing. Thank you.